This is a 30-year-old male patient with a history of recent pancreatitis. We are going to discuss the current CT scan and the previous CT scan, which was performed approximately 3 weeks ago. Here is the pancreas. There is a small lesion here. There is significant ascites, free fluid in the abdomen. We can see a pseudocyst in this region near the pancreatic head, and as we go little further up, there is another pseudocyst here. Now let's see the previous examination. Here is the previous CT scan performed approximately 3 weeks ago. There is only one pseudocyst in this region, and the free fluid in the abdomen is very little. We can see again this lesion in the pancreas. I will zoom in the previous CT scan. Here is the lesion, and here is the current CT scan, and we can see that there is some worsening of the findings. And let's go again in this region, and we can see that this lesion is little larger. It is small finding, but maybe it's important because it may represent the disconnected pancreatic duct syndrome. And what is this? Disconnected pancreatic duct syndrome is important but often overlooked complication of acute necrotizing pancreatitis that occurs due to necrosis of the main pancreatic duct, usually focal or segmental necrosis, which results to disconnection between the viable upstream of the pancreatic parenchyma and the duodenum. So all the secretions cannot reach the gastrointestinal tract. In other words, there is disruption of the main pancreatic duct due to necrosis. According to this, we can explain this progress and worsening of the appearances, the significant new free fluid in the abdomen, the persistent pseudocyst, and another one pseudocyst. So the findings can be explained just from this small finding, which probably represents a disconnected pancreatic duct syndrome, which results to recurrent pancreatic fluid collections, external pancreatic fistula, chronic abdominal pain, recurrent pancreatitis, and so on. Because of lack of awareness of this important complication, the diagnosis of this condition usually delayed, and the delay in the diagnosis increases the morbidity and the mortality of the disease. The treatment of choice is a surgical approach with resection of the necrotic region of the pancreas. Dear friends, thank you for watching this interesting video. If you like my videos, you can consider to subscribe to my channel, so you will be notified the next time I will upload a new video to my channel. Thank you, and see you the next time soon.